and welcome to our webinar. On behalf of Global Schools Foundation, thank you for joining us to view this very important webinar. As we prepare to reopen our schools on the 1st of April, this would be a good time for us to recap on the measures being taken by GIIS for the safe continuity of your child's education. The health and well-being of all of our students is our highest priority. We will be strictly adhering to the guidelines by all of our local government agencies to ensure the safety of all students, teachers, and parents. There will be a panel discussion that we have prepared to discuss and deal with the current COVID-19 pandemic. Topics that will be shared with you includes travel advisories, leave of absence and stay-home notices, safe distancing in school buses, classrooms, cafes, and for parents as well, virtual classrooms, and online facilities. We'll soon hear from our experts on steps and measures we can adopt. Our esteemed panel members are Mr. Rajiv Katyal, Country Director for Singapore and Deputy Chief Operating Officer, Ms. Melissa Maria, Principal for Smart Campus, Ms. Rekha Varghese, Vice Principal for Smart Campus, Mr. C.V.K. Sastry, Head of School, East Coast Campus, Commander J. Prabhuram, Manager for Operations. Let us now begin with the discussion as I hand the proceedings over to Ms. Melissa Maria.
Good day, everyone. Thank you for joining us for this webinar session on COVID-19. I am Melissa Maria, Principal of the Smart Campus, Singapore. We all know now that COVID has been declared a pandemic by the World Health Organization. The gravity of the situation is such that government authorities around the world, including Singapore, have rolled up their sleeves to work around the clock and nip the menace in the bud. All countries have put stringent measures in place, especially for schools, to make sure that the student community stays safe during these uncertain times. Global Indian International School has followed suit. Your child's health and safety has been foremost in our minds, and we have put in place a number of measures to ensure that all the precautionary measures put in place by the authorities have been implemented. Even more important is the fact that your child's education journey should continue uninterrupted in the current situation. We have come up with a unique educational technology to bring classroom to the home of the child for those not able to attend school. We have therefore gone a number of steps further to give an extra layer of safety for our students and help them continue their educational journey unhindered. Dear viewers, we have received a number of queries and we've been receiving news from various sources. One of the queries that we've got is, can we put together all those critical points that are needed and mandated by authorities that we should comply with? Let me invite Mr. Rajiv Katyal to address that query.
Thank you, Melissa. As you rightly said, we are in the midst of a dire situation. The world is fighting hard to control the virus. Singapore is also on the forefront of this fight. Regular communication from the government is keeping the populace updated on the steps being taken to curtail the fallout of the spread of this virus. All authorities have been controlling the borders and tracing the virus within their countries. They have been testing, educating the public, and providing great healthcare facilities. Which is why, even though the number of cases are increasing, the casualties are firmly negligible. We therefore see daily updates from all ministries that give a very transparent view of the situation in each country. All countries have declared restrictions on travels. There are notices like stay-at-home notices being issued, leave of absences being exercised, safe distancing measures being observed. At GIIS, we have implemented these guidelines for our parents, students, and staff in the strictest way possible. Students, parents, teachers, staff who have traveled overseas are required to submit a declaration form within 24 hours of travel. Those who have returned to Singapore, for instance, between 14th March to 20th March, have been asked to go on leave of absence, while those who have returned after 21st March will be required to observe a 14-day stay-home notice. The LOA and SHN rules are applicable not just when students, parents, teachers, and staff travel, but also if they share a household with some who have traveled. For example, if your parent has traveled, the parent will be given the stay-at-home notice, while the child is required to observe the leave of absence. This is mandatory, and any violations to this will be reported to the authorities for everyone's safekeep. We are also observing safe distancing measures in the school. The working hours of non-teaching staff have already been staggered, with members working from home for 2 to 3 days a week. But in case of teachers and other essential staff, we have strictly implemented the 1 meter distance rule, which means they are sitting well away from each other when at their desks. Even within the school, when interacting with each other in the corridors, cafeterias, and other areas, congregation of more than 10 people has been prohibited, and seating arrangements have been marked for everyone to follow.
Much more has been done within Singapore to dispel fears and eliminate rumors. In fact, Senior Minister of State Dr. Janil Puducherry was at the Smart Campus earlier this month to speak personally to the staff and spread awareness about the do's and don'ts in view of the COVID-19 situation. Let's take a look at his message through this highlights video.
So I think the impact of this is quite serious. It's been characterized as a generational crisis. I think we'll be talking about this for 20 or 30 years from now. I hope 20 or 30 years from now, this is still the thing that we're talking about because nothing else has come along. But this is quite possibly going to reshape many of the norms, both on a social and personal level, but also on a global, international level. Secondly, a prioritization on our healthcare services. The data from around the world quite clearly demonstrates that a significant amount of the mortality is associated with a healthcare system that is overwhelmed. So for us here in Singapore, keep that confidence in the people here that they will have access to healthcare. Quick, urgent, subsidized for the appropriate people, and making sure that even for the non-COVID essential services for healthcare, they are maintained. Internally, our second strategy then is aggressive containment, contact tracing, where with every single case, we try to hunt down the contacts, quarantine them, the contacts of the contacts if necessary, as we follow the disease through our society. We believe this effort is still working, and one of the markers of that is that most of the cases that we have seen, the new cases that we have seen over the last few days, have come from overseas. And in fact, that's overwhelmingly the majority. The majority are coming in from overseas. The second biggest group is linked to known clusters, and then a very small number which is unlinked. In fact, usually none. And even those that are unlinked, when we do enough contact tracing, eventually we find a link. So, for all these reasons, we believe that our strategy is working for now.
And so you have a very good grasp on the ground. How do you see this medically evolving in terms of peak, in terms of further, downsides that are likely to come as a result of the current infections? Of course, in Singapore, we have contained it to a large extent, and with all the measures that you explained. But do you see any further downside likely to happen going forward?
I think it's too early to predict with any degree of certainty. Biologically, we know what happens. I mean, the world has been through pandemics, epidemics. We've studied viruses. We know how infections spread in communities. The risks then are, does the virus change in some way? But the evidence suggests so far that it's fairly stable and it hasn't demonstrated a lot of shift and drift in its composition. So I suspect the downsides, the unexpected, are going to be not associated with the biology, but with the economy, or the politics, or the geopolitics. What is the great unknown is how people will respond and be forced to respond.
A lot of other countries are going in the lockdown mode, and they say that that is the best way to fight coronavirus and to contain the spread of the virus. Is Singapore planning any such lockdown in the future?
It is a useful tool if it is used in the right way, at the right time, in the right circumstances. In these other countries, they have the ability to self-sustain their local and domestic supplies and economy. So even if they lock down personal and social gatherings, some of life can go on. In Singapore, we have the advantage that we're small, fairly cohesive, and we can get information out. And there are people in the community that will help to multiply that information, so that when we say we don't want to go for a lockdown, what we want to do is go for social distancing, the outcome is just about where we want to achieve. If you want to go for a lockdown, complete cessation of activities, it is a useful tool if your containment strategy is no longer working. In other words, I have a positive case, and now I have a sense that maybe he infected. Now I had close contact with 50 people, I can only find 10 of them. And the other 40, I don't know where they are, and suddenly I start seeing all these unlinked transmission clusters everywhere. From the science of it, we know that if you closed everything for 2 to 3 incubation cycles, that works out as about 2 to 3 weeks, you can quite effectively reduce the transmission through the community. So would Singapore do that? Possibly. We don't want to rule out any of our strategies. The conditions for doing that are not yet met, which is we have untraceable, uncontrollable community transmission, that we have the certainty that we're not going to have new cases coming in from overseas, and that after we come out, it's not going to start again, right? You want to sort of bring it down to some minimal level and hold it there.
Sheetal, who is in the audience, has asked, do people coming from affected countries going for self-quarantine without a fever, would then the immediate family members also have to self-quarantine?
The quarantine or the stay-at-home notice is basically because you yourself have been directly exposed to risk. If you are exposed to risk but are not yourself the carrier of risk, then the person who's next to you does not have to then take extraordinary steps. So if you are my contact, just as an example, you are found to be positive, you will be in hospital. Because I have had contact with you, I will be under quarantine. But the assumption is I don't carry the risk myself yet. You were the risk. I have been exposed to that risk. So my family member in my home has had no contact with you, is not exposed to the risk. I am the intermediary. During the time that I am in quarantine, as soon as I get a fever, now you have been exposed to risk. If I don't get a fever, you have no risk. But if I get a fever, what I should do is report to hospital immediately.
You had the portfolio of education earlier. As a school, what the school has done is, given the uncertainty of how long the situation will continue, we have launched something called virtual classrooms. Essentially, it is video conferencing available in the classroom. So students who opt to study from home, they stay at home, just sign up. And our entire school, I'm happy to say, our entire school is on virtual classrooms. So every student can join their respective classrooms. But as the various MOH graphics, etc., that have come, we've spread in the school. We are sending important updates to parents in addition to what they get. Any specific suggestions you would like to leave for the students from your perspective as to what they should be more careful about?
Firstly, the students seem to be relatively, I don't want to say protected, but they seem to be spared from the worst effects of this virus. It really is something where if you are over the age of 60, you need to take extra care. I'm telling my parents, both of whom are in their 80s, if you can just stay at home for the next 2 weeks, you should do so. After which I'll say, how about another 2 weeks? But, they like to get out, they like to go and do things. If they do, I'm telling them to avoid crowds, go to the park by yourself, minimize social contact. The same advice would be useful for students. The same advice would be useful for students. Not because they are at great risk of suffering from this, but because they can have very mild symptoms. They will still have an infection, and then it affects the rest of the family. So they can be a vector for transmission. So even though they don't need to be as fearful for themselves, it's not it is actually a good thing if they have some anxiety on behalf of their family. So for the students, not shaking hands, not, having too close social contact. I mean, telling a teenager don't have so close social contact may be challenging, but it's okay. Now is the time to say, please use your phone instead of meeting in real life. As a parent of teenagers, I spent the last few years saying, put your phone down, go and play with your friends. Now I need to say, don't play with your friends, call them on the phone instead, But I think we have to make the point that this is the time, hopefully temporarily, where you need to break these behaviors apart. So it is a balanced strategy that we're doing for our MOE national schools, where you remove the most high-risk activities, where you go to large inter-school sports meets. You don't know which kids are coming and who's shaking hands and who's sweating here. But if you want to do your sports training, groups of 20, groups of 30, groups of 40, you all know each other by name, by sight, by phone number. If one of you becomes sick, I can find every single one of the rest of you and isolate you. That's the kind of strategy that we are going.
We have received another very important question, which is, what are the current measures taken by GIIS? Let me now hand over the floor to our operations team to allow them to explain how the school has prepared itself logistically to deal with the situation. Commander Prabhuram, please.
As all of you know, COVID-19 is upon us, and as a school, we have taken our responsibilities seriously to ensure that the campus is kept safe, secure, and clean to deal with the crisis in hand. The first step towards this is ensuring that everyone entering the Smart and East Coast campus are not showing any flu-like symptoms, which is why temperatures of all individuals entering the premises are checked at the gate by the security personnel. This includes all our bus drivers, taxi drivers, visitors, and vendors. Anyone found with a temperature is asked to proceed home. We have procured the latest brand new non-contact thermometers to check temperatures of all our staff twice a day. These thermometers were used to check students' temperature as well. Incorrectly calibrated thermometers, if found, are immediately replaced. Students and staff are also encouraged to carry their own thermometers for temperature checks for an extra layer of safety. 20,000 masks have also been procured for the campus to deal with any eventuality that arises on a day-to-day basis. At our campus, hygiene is an important aspect of our fight against COVID-19. Our efforts has consistently been to follow guidelines, spread the official messages, and implement all the plans in the school. We have already been sanitizing the campuses on a regular basis. All important points of contact like classrooms, cafes, tables, chairs, doorknobs, and lift buttons are sanitized every day. During the holidays, we use specially procured sanitizers to clean the entire campus. Going forward, this activity will continue. We are also doing our best to spread the message across the campus. Our digital signage system is constantly running messages on hygiene methods like washing hands, wearing of mask, seeing a doctor if necessary, taking temperature daily, and importance of social distancing. Also, in view of the social distancing rule and in line with our idea behind being the digitally savvy campus that we have already put some initiatives in place which will allow parents and students to carry out urgent school-related matters online, saving them time and in today's times prevent them from flouting any rules. Our travel declaration forms have already gone digital. With e-consent and e-payment facilities in place, parents need not come to school for payment of fees or give consent for student activities. Recently, we also introduced online book sales with a home delivery option. It received a tremendous response from our parent community, and I am glad to share that the booking and distribution was carried out smoothly during these term holidays. We have also switched to using webinars and virtual connections, live links on Facebook, etc., to broadcast our events to a larger audience rather than having people coming to the campus.
Thank you, Commander Prabhu, for that comprehensive input. I would like to add to Commander's points on the initiatives taken by the academic section to encourage safe distancing and easy access to facilities online. We already had the e-consent forms in place to enable students get consent from their parents to participate in various activities. We also have been providing e-payment facilities to parents to pay term fees, top up cash cards, order food from the cafeteria. This has indeed worked very well for us in the past, and in the coming, it is going to be useful. Even our travel declaration form now is available online. All our events that require a gathering of students and parents have been called off indefinitely. We have started recording the events live and providing parents with the link so that they do not miss out on participating in these important milestones in their child's lives, like graduation ceremonies, sports performances, etc. To this, we are adding parent-teacher meetings, orientation sessions, as well as workshops by universities' selection for graduating students. For homework, we already had Google Classroom tool in place. All this is ensuring that students stay safe while parents are equal participants in the educational journey of their children. I now invite Rekha Verghese, my co-panelist, to share her views.
This is true for the primary campuses as well. Here at Smart Campus Primary, we have taken similar steps. Students in the primary sections will also be staggered in the classrooms with the 1 meter rule to apply. We have already segregated their break times. In the new academic term, we will ensure that students do not sit in groups during lunch breaks. Teachers will be on the lookout around the cafeteria to help enforce the safe distancing rule. Our online efforts have extended to cohorts of all curricula. For example, Recently, we held a student-led conference for IBPYP where individual portfolios were sent home and students made presentations in front of the parents. The video of this process were recorded by parents and sent to us. We also telecast the prize distribution ceremony for Sports Day winners live so that parents could be part of this proud moment of their children and not miss out on these achievements. All this is to ensure that no student will lose out in any way due to the recent dire situation in the world, and they will continue to benefit from all the programs and offerings of the school as before.
Thank you, Rekha. That was really insightful. I now invite Mr. Shastri to share his views.
At the Green and Happy East Coast campus too, we have been implementing all the required precautionary measures by taking temperature readings twice daily, educating children on the necessity of frequent usage of disinfectant before and after the short breaks and lunch breaks. Disinfectants are made available in each classroom. For pre-primary and primary classes, teachers do take the responsibility to ensure that the children use the disinfectant as and when necessary. For higher classes, student council members are taught to use it responsibly. I must thank all the parents in having great faith in our measures, as the daily student attendance has been a good percentage, up to 90%. However, for students of grades 6 and above who could not make it to school, started the virtual classes during the revision time. Before the year-end examinations, I must say it was a great success as students thoroughly enjoyed the new experience of learning from the comfort of home.
Thank you, Mr. Shastri. Dear viewers, as we commence the academic year 2020, I would like to share with you that all our campuses around the world, be it India, be it Japan, be it the Middle East, be it Malaysia, or even Singapore, we are going full steam on the virtual classroom model. We invite you to watch a short video so that you understand what the virtual classroom looks like.
Today I couldn't go to school, but I could attend these lessons from my home and I didn't miss out on these. The platform made it very much similar to how it would be if I was in a classroom, because I could see the boards, I could see the teacher. I could ask the teacher a couple of questions I had related to the subject, and she had the ability to answer those while she was teaching at the same time.
The classrooms are very interactive. We have a fully equipped digital classrooms with smart boards, video conferencing, mics is enabling us to give greater flexibility to our students. So it's non-restrictive. So if our students have stepped out due to extracurricular activities, or they're participating in sports or MUN, or if they're not well, I think it makes it easier for the teaching to continue.
When I'm using the virtual classroom, I can reach out to the students who are here as well as the students who have logged into the system. This keeps all the students at a similar pace and helps them to understand how the class is progressing. GIIS is way ahead of most of the schools in Singapore in the concept of implementing technology in class, which is student-friendly and also teacher-friendly.
It's going to set new standards in learning because I think it's going to be much more collaborative and student-centered now.
This is a tool that is facilitating anywhere, anytime learning for our children. To see the kind of excitement and the fact that so many of them are logging on from home is a testimony that this is a program that is working wonderfully well with our children and teachers.
Today I attended my virtual maths class. The teacher discussed all the questions of the revision worksheets with us. I could interact with my friends. I could discuss with them like what questions and what answers.
When I first got the opportunity to attend this class, I thought
I would miss out on a lot of factors that I would get in a classroom, but this wasn't true at all. And my teacher also helped me by asking a lot of questions and making sure that I always felt like I was a part of the class. I could study and do my assignments just as well as I would be able to do on a normal day.
So as a teacher, primarily, we come to school and we have class filled with enthusiastic children, and we are teaching, we are conversing, discussing. There are times when students are not able to attend classes, or in a case like this, where there is a certain concern regarding health and where parents want to take a bit more precaution, then virtual classroom is the key. It has the solution to all those problems where students or parents might fear that their children may miss out on education.
GIIS has always taken a step ahead in introducing technology in various school processes. At Green and Happy GIIS East Coast campus, both teachers and students are able to enjoy the 21st century state-of-the-art learning.
I have worked across various schools. GIIS is definitely on the forefront when it comes to technology and innovation.
I feel that this is a really good concept and I wish that it goes on. I'm able to catch up with the syllabus and not miss out on any lectures or lessons. And instead of doing school at school, I can do school at home.
The introduction of virtual classroom is definitely a golden opportunity for our students, our youth, who are going to be our future.
In continuation to the queries and questions as to what are some of the additional measures taken by GIIS, may I invite my co-panelist, Mr. Rajiv Katyal, to share his views.
Thanks, Melissa. The school has taken some drastic measures to create a safe learning environment for the students. Starting this academic term, we'll be dividing our entire cohort of students in both the campuses into two teams, Team A and Team B. Each team will have a week-long roster in which it will be determined who will log in from home and who will be physically present in the school. Those in the school will be maintaining a safe distance within the classrooms and corridors, while those at home will be sent a video link to log in to classroom activity. The two teams will then swap positions the following week. At no point of time will the two teams meet each other. At no point of time, the classroom strength will increase more than 50% of the cohort. In case this happens, the classroom teacher will have the discretion to send some pupils home to avoid crowding of the classroom. While in school, social distancing norms will be implemented in the corridors, while we'll also make sure that the students do not group together in large numbers. During the school holidays, we have ensured that certain sanitization and disinfection measures were put in place. Classrooms were sanitized through ecostatic control devices with each table, each chair, each whiteboard, every corner sprayed with disinfectants to thoroughly clean the premise. Our team has marked each bench with physical stickers in keeping with the safe distancing rule to make sure students in the classroom sit 1 meter away from each other. All our campuses will continue with the daily disinfection of their premises as per the guidelines issued by the Ministries of Health. For example, all areas of maximum usage like lifts, cafes, toilets, taps, doorknobs, etc. are being cleaned and disinfected on a daily basis. Our sick bay area is sterilized at the end of each working day, as are all our classrooms. Thank you everyone for joining in. I hope this session has been informative enough. We look forward to ideas from parents to improve our methods of safety and hygiene further. You can share your responses on the webinar content and COVID-19 information at the email given below. We are also attaching a document on our COVID-19 readiness, which can be downloaded from this session by the parents. More announcements and alerts will be made on our MyGIIS app, so please do look out for them.
Thank you, Mr. Rajiv, for addressing that question. Dear viewers, we come to the end of this webinar session. I take this opportunity now to thank my co-panelists, beginning with Mr. Rajiv Katyal, Commander Prabhu Ram, Ms. Rekha Varghese, and Mr. Shastri. Dear viewers, webinars is the way forward. GIIS is going to engage our parent community and students with many more webinars going forward. To start with, our orientation session that commences in 2 days from now is going to have this model of webinars. We encourage more parents to join our webinars and pass on this information to your friends as well. For all those parents who missed the webinar today, please do take heart. You would be able to view this webinar once again.
May we also invite all parents to please adhere to social distancing, personal hygiene. We seek your support, your enthusiasm, and your understanding. Thank you very much.